Listen carefully. So yesterday we have seen what is circulation. Yes or no? Yes. We have seen the circulation to the brain and facial. So we have seen the arterial supply to the brain. The blood is supplied by circle of Willis, and to the external face, the blood is supplied by external carotid arteries. So we have right carotid artery, we have left carotid artery. Right carotid artery is divided into two types. First one is to the brain, internal carotid artery; to the face, external carotid artery. Respectively, right and left. Respectively, right and left. Now the blood went inside. The blood went inside. Oxygenated blood was carried to the brain and the other facial parts to the upper part of your body. Now, how it is coming back? How it is coming back? Now, whatever you are seeing here, this particular vein, which you can see here, this particular vein is left superficial temporal vein. Is what, ma? Left superficial temporal vein. Now, listen to me. Why I am saying left means I am showing you only this part. I'm showing you only this part. So if I'm showing you this part, I can say right, because the image was like this. Because the image was portrayed in left side, I'm trying to show you only left side. Okay. Similarly, you can think to the right side also. If it is because in the blood circulation, both right and left were similarly occupied, parallelly occupied. Yes or no? Yes or no? Now listen to me clearly. Here, if you see this particular area, just give me a moment. Yeah. Now this is a left temporal vein. Okay. What it is? Left temporal vein. This is also left temporal vein. This is also left temporal vein. Now listen to me. What is happening here means all these veins which are present over here. All these veins which are present over here, this particular vein, whatever you are seeing, this particular vein, this is middle temporal vein. This is what, ma? Middle temporal vein. And this particular vein, whatever you are seeing here, this is extended to superficial side. Okay, this is extended to superficial. Now, the one vein is you can observe, this is superior vena cava. Okay, this is what, ma? Superior vena cava. Nothing but now you have whatever the veins that are present near the neck. Whatever the veins that are present near the neck, these are called as jugular veins. These are called as what, ma? Jugular veins. Now, this jugular vein, whatever it is there, ultimately, if the heart is present over here, it will open up into the right atrium. It will open up into the right atrium. So right atrium is carried out by superior vena cava. Yes or no? Yes, so from superior vena cava, what is there means we have jugular vein. What we have? Jugular vein. Now this jugular vein, this particular jugular vein is divided into two types. So we have internal jugular vein, we have external jugular vein. Internal jugular vein means it is present inside. External jugular vein means it is present outside. You are clear with here? Yes or no? Now followed by when it goes little higher. Now we have a thyroid. Yes or no? Yes, yes or no? Yes, so here is the thyroid vein. From thyroid gland it receives the deoxygenated blood. From thyroid gland it receives the deoxygenated blood. Now neck has anterior portion, neck has posterior portion. So we have posterior external vein, we have anterior jugular vein. One person, please. Superficial temporal artery. So we have temporal vein 2. Yeah. Next. Maxillary artery. Okay. So we have left maxillary artery. Next. Facial artery. So we have facial vein. three. Occipital four. Temporal. See here we have temporal five. Superior thyroid artery. Okay. See here we have thyroid. Yes or no? Yes or no? Yes. So all six which are extended in external carotid artery, these came here as veins. Lingual came, facial came, maxillary came, occipital came, superficial temporal came, and thyroid came. Came or not? Yes, sir. Yes or no? Yes, sir. Now, when I am talking about circular Willis, so I said supraorbital. Supraorbital means this frontal region. Yes or no? Yes, and orbit means what? Above the eye, supraorbital. We have it or not? Yes, sir. Yes or no? Yes, now, sir. Facial artery is there. So we have facial vein. We have what, ma? Facial vein. So this is what the venous return to the from this head part, head and neck. This is the venous return from the head and neck. So we have a three. This particular tree is jugular vein. This particular tree is what, ma? Jugular vein. And this jugular vein is divided into two types. First one is external, second one is internal. First one is external, second one is internal. Yes or no? Yes, sir. Yes or no? Yes, so from these veins, from external vein, we got anterior jugular vein. We got what, ma? Anterior jugular vein. Anterior jugular vein. And from this internal jugular vein, we got thyroid vein. Yes or no? Yes, we got left pharyngeal vein. Yes or no? Yes, sir. We got left lingual vein. Yes or no? Yes, sir. Yes or no? Yes, sir. And further, it is further extended into facial vein. Yes or no? Yes. Maxillary vein. Yes or no? Supraorbital vein. Left middle temporal vein. Am I clear? Yes, sir. Am I clear? Yes, sir. Now you are talking about the external jugular vein. From external jugular vein, we got posterior external jugular vein. Here it is. We got for example left column. Left column is coming from internal. Okay. Now we have occipital vein. We have superficial temporal vein. You got